Good morning, everybody. Bear with me if I have a cough or something in the middle of my story. I am coming off of Las Vegas COVID.
Oh boy.
Here we go. My article headline reads, Marijuana dependence is increasing amongst VA patients, particularly those with psychiatric conditions. Says a study published last Wednesday in the American Journal of Psychiatry found that marijuana addiction has risen among Veteran Affairs patients since 2005, with veterans with psychiatric disorders seeing greater incidences and increases. Marijuana is legal for medicinal use in 38 states and recreational in 24, as well as the District of Columbia and 2 territories. But 20 to 30% of people who use marijuana will develop some sort of cannabis use disorder, according to this article. Researchers examined Veterans Health Administration electronic health records from 2005 to 2014 and also from 2016 to 2019 to determine the prevalence of cannabis use disorder. They found that veterans with bipolar and psychotic spectrum disorders had nearly doubled the prevalence of the diagnoses than those with anxiety, post-traumatic stress disorder, or depression. The study did not delve into why the diagnoses are on the rise, but Dr. Ofer Levine said that a number of factors may have contributed, including changing attitudes towards marijuana and legalization of marijuana in many states. During the first time frame, the greatest increases in cannabis use disorder diagnoses were seen in patients under age 35. But beginning around 2016, rates rose significantly for those older than 65. A study published earlier this year found that state laws on medical and recreational marijuana played a significant role in increases in cannabis use disorder diagnoses, especially in older patients. The more recent study was not found without its limitations and relied on data from electronic health records that could include disparities in diagnoses. The Senate approved a bill that would allow VA doctors to recommend medical marijuana in states where it's legal. The bill must survive a conference between the 2 chambers. Studies on the effectiveness of marijuana for treating veterans with PTSD have shown mixed results, and the most scientifically rigorous study showed no significant reductions in post-traumatic stress disorder symptoms between a placebo and cannabis. The VA recently stepped back from conducting research on cannabis as a potential treatment for psychiatric conditions in veterans and encouraged researchers to study other drugs, such as MDMA and psilocybin, to treat mental health conditions. Now, you guys, many of you know I've shared that I have a bit of a mental health background. I spent many years working with patients who had PTSD, anxiety, all sorts of mental health challenges. And one of the things that I will tell you is that there is a DSM, a Diagnostic and Statistic Manual, that assists clinicians with diagnoses. And that book is always evolving. Every couple of years, there's a new rendition that comes out, a new updated version, because our ability to diagnose and our training and clinicians' abilities to identify things earlier on has become more significant. Same thing in the medical world, the same reason why we can catch cancer earlier on. These sorts of things are being diagnosed probably far too much, far too loosely. I think that if you're explaining cannabis use to your physicians at this point still in our society, we're really seen as stoners still because these clinicians don't really understand. But I'm going to go ahead and leave it right here and see what the rest of my correspondents think about this exciting or bootsy study.
It's a truckload of horse shit, Mandy.
Exactly.
I mean, I have butted heads with psychiatrists over this many, many times. Everybody on this show would be diagnosed with a cannabis use disorder. I guarantee you.
Absolutely. And you know, the thing here is that people are just probably starting to feel more comfortable sharing their cannabis use with their clinicians.
Mm-hmm.
They probably have been using it all along, didn't share it, didn't get this diagnosis, and now that they are feeling like it's okay to be more open and transparent, they're getting the label.
Yeah. Well, traditionally, to be diagnosed with a use disorder, you had to have the use of that substance having major impacts on your life activities of daily living, going to work, being able to feed yourself, take care of your responsibilities. Okay. And when you take cold medical records and try to figure out, does somebody really have a problem getting up in the morning, getting to work? Think you're just pulling shit out of thin air. And there's bias built into this that when you confront the psychiatrist with the bias built in, you can tell their butts puckering by the look on their face because they know it's bullshit. Okay. You need to do targeted studies where people are comfortable telling you exactly what I do. Okay. Which they're not with the VA because the son of a bitches will castigate you and put in the records that you've got a use disorder of something. Next thing you know, your benefits are all fucked up. So people are not going to be honest about this. That's the part of the problem. And to repeat what we were told by Mark Twain, there's lies, damnable lies, and statistics. There's no goddamn way 30% of the people who use weed are addicted to it. The 10% number I was taught years ago, I thought was still too high. Now it's 30%. How's that? It's bullshit.
And just because you like it doesn't mean you're addicted to it, right, Dale?
No, it has to do with it having major impact on your activities of daily living, your ability to go to work. And if they were to take the criminal consequences out of this, you would find very few people with substance abuse disorders for cannabis if you weren't going to jail or the threat of this. And a lot of drugs are the same problem. If you made them legal, and far fewer people would have real substance abuse problems. Because you get pinched, now you got problems getting to work because you're fucking in jail. You can't bond out. The whole thing goes downhill. Not because the substance had you addicted, but you got pinched with it. That's it ruins the whole analysis.
Those are all facts. You have anything to say on this, Luke?
Yeah, I mean, this is the thing with it, right? Is we have these situations where this whole article is propaganda, right? You have these stats that become misquoted and taken out of context, where you say these individuals that have these mental health issues, right, have a higher tendency to use a lot of cannabis. Well, how about let's just backtrack and say maybe the VA isn't doing what they're supposed to, and these people are self-medicating because they have severe PTSD. I mean, that's just the first question I would ask. The second point that I want to make here is, like, a lot of times we get these skewed statistics of, like, I just read one that said in states where cannabis is still illegal, rehab numbers are through the roof. Well, they are through the roof because the court, once you are in justice impacted with cannabis in one of those states, the courts make you go to mandatory rehab. Most of these rehabs are filled with 80% of these people that have cannabis use disorder, some BS like that, and they're forced to be in these rehabs, and that's the bread and butter of that whole entire industry. So it's going to continue to happen. You have to really analyze these stats because they are super skewed, super misleading. And if you listen to propaganda like this news article at military.com, you'll be totally misled.
What was that term you said? Justice what?
Justice impact.
Justice impact. I haven't heard that before. Justice impact.
Yeah, we coined that. Profitbrands.com.
Oh, is that a Profit Brands? Okay, all right. I thought it was from the Wokies for a second, but okay, all right, good. I'm glad to hear that it's from Profit Brand. I'm with that. Justice impact. I can work with that. And so I guess we're all in agreement that this is a total propaganda piece. I think that everyone. Stone, you have any thoughts on this? You're on mute. You're on mute, Stone. There you go. No, you got problems.
Mandy's speaking.
Oh, he's got his.
Can't hear Mandy.
I can hear Mandy.
I was listening to Mandy, bro. Mandy was talking about Luke's program.
Mandy was dropping knowledge, bro.
Yeah.
Go for it, Mandy.
Yeah, Mandy hit it.
I was just saying that Luke actually created this really cool program.
It's
called the Justice Impact Program. It's in collaboration with Glass House, and Profit Brands is a big supporter of it. Obviously, you can also access information about it through profitbrands.com. But the whole entire premise of the program is to help individuals who are currently incarcerated against a cannabis crime and or their family members to determine whether or not they could be eligible for some of the new amendments to help them get out, and also to help match those individuals who do qualify up with legal support. So it's actually really a cool word, a phrase, and I'm very proud of it.
I can get with it. Justice.
The phrase actually was coined by Mandy, so I'm going to give her 100%.
Oh, shout out
It's
to
something,
Miss
it's something
Mandy.
that we actually, you know, it hits home. It's the tone is right, and it's a term that we want to kind of use more than people who were incarcerated, convicts, formerly incarcerated. You're just justice impacted.